بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. In this lecture, we are going to discuss osteomyelitis of jaws, including maxilla and the mandible. Infection of bone called osteomyelitis. In children, mostly affect long bones of arms and legs. بينما بالadults, more in spine, hip bone, and feet of diabetic patient. The main cause for osteomyelitis in long bones or in other sites, Staphylococcus aureus, that enter blood through wound and then reach to the bone. The general signs and symptoms are pain, swelling, and dysfunction. Diagnosis of osteomyelitis of long bone. Simple X-ray may be enough for diagnosis, otherwise use bone scan or MRI. And treatment include aggressive antibiotic IV for about 6 weeks. Sometimes surgery required to remove the infected bone. Then osteomyelitis can be defined as an inflammatory process of bone marrow and adjacent tissue of the bone. Usually the inflammatory process is widespread, involves the entire marrow cavity. The process is very destructive with extensive secondary necrosis of the bone. قلنا mostly in long bone. Necrosis of the jaw. There are many causes for necrosis of the jaw. حتى نفرق بيناتهم وضعت تسميات مختلفة according to necrosis. If the necrosis of the jaw caused by radiation, as in case of cancer treatment, it is called Osteoradionuclosis. بينما necrosis of the jaw caused by using the medication bisphosphonate, a drug used for the treatment of osteoporosis, هشاشة العظام, the necrosis now termed as osteonecrosis. While jaw necrosis resulted from dental infection or jaw trauma called osteomyelitis. Then osteomyelitis of the jaw mean caused by either dental infection or jaw fracture like car accident or gunshot. Osteomyelitis of jaws يعتبر less common than other side, but highly destructive lesion, defined as infection and inflammation of bone marrow, and then quickly extend to the periosteum. Osteomyelitis of the jaw, highly destructive lesion, appear as radiolucency in a radiograph. The main causes for osteomyelitis of the jaws: dental infection, trauma or fractures, for example, gunshot or car accident, and radiation. The radiation causes destruction of blood supply, which result in osteoradionuclosis. Systemic factors for osteomyelitis of the jaw: immune deficiency. Due to genetically immunocompromised patient, immune suppression by using immunosuppressive drug like those used for autoimmune disease or in certain cases of cancers. Diabetic mellitus, مرض السكر. smoking. طبعا smoking affect the bone by decrease blood flow to bones. وتعرفون بالhealing process نحتاج إنه البلد يوصل بكميات كافية to the inflammatory site. Decrease the absorption of calcium اللي يعتبر important for building of bone. Slow production of cells required for healing of bones اللي هي osteoblasts. Affect hormones like estrogen اللي يعتبر necessary for building bone in men and women. Drinking or heavy drinking of alcohol, or research reported that alcohol lower the body's immune system. Malnutrition, for example, vitamin deficiency, and the extreme of ages. People or patients considered more susceptible to have osteomyelitis are those with hypovascularized bone, patched disease, osteoporosis, or those with major blood vessel disease. Microbiology. Osteomyelitis is considered an opportunistic infection. And the microbe involved vary according to the cause. When the causative agent dental infection, a mixture of alpha hemolytic streptococci and anaerobe like Fusobacterium, Prevotella, Piptostreptococcus are implicated. In contrast to long bone that caused by Staphylococcus aureus. بينما when they cause trauma like a fracture of the mandible, the causative agent or microorganism is Staphylococcus epidermis. Then the causative agent for jaw or long bone osteomyelitis vary according to the cause. Classification of osteomyelitis. There are many classification systems for osteomyelitis according to duration, causative agent, symptoms, radiographic appearance. But in general, classified into suppurative, mean caused by bacteria, and non-suppurative, mean not caused by bacteria. Example for suppurative osteomyelitis, acute and chronic osteomyelitis, and examples for non-suppurative osteomyelitis, focal sclerosis osteomyelitis, and diffuse sclerosis osteomyelitis. The pathogenesis for osteomyelitis, long bones. The microorganism come to bone via blood. معناها hematogenous route. While in jaw bones come to bone either from adjacent dental infection or from traumatic fracture, where the bone communicate to mouth or external environment. طبعا طلاب الماندبل affected more than maxilla لأسباب متعددة أهمها due to difference in blood supply. In maxilla, more blood supply than in mandible. Only one source of blood اللي هو inferior alveolar artery. Thin cortical bone, unlike the mandible, in which cortical bone is thick, so prevent the penetration of periosteal blood vessels and less medullary spaces. Then in mandible, more osteomyelitis expected than in maxillary للأسباب اللي ذكرناها قبل قليل. قلنا there are many classification systems for osteomyelitis ومنها or according to the duration classified into acute and chronic. When the infection less than 2 weeks consider acute. وقسم يقولون أو هاي الفترة تمتد إلى شهر. أكثر من شهر يعتبروها chronic. طبعا no radiographic changes before 2 weeks because the destruction of bone not yet occurred. لم يحصل بعد. Acute osteomyelitis, the main causes for it either odontogenic infection or trauma like jaw fracture. The main clinical signs for acute osteomyelitis: severe and deep-seated pain, fistulae not present. وهذه نقطة مهمة to differentiate between acute and chronic suppurative osteomyelitis. Swelling, lymphadenopathy, paresthesia of lower lip, associated teeth loose, tender, and the gingiva appear red and swollen. Radiograph, loss of trabecular bone or radiolucency. This is after 2 weeks. يعني إذا اعتبرنا إنه الأكيوت أوستيومايلايتس شهر فترتها، فخلال هذه الفترة after 2 weeks نقدر نشوف radiolucency. ولكن إذا اعتبرنا إنه الأكيوت ستيج هي أقل من 2 weeks فالأكيوت stage not associated with any radiographic change. Histopath. The bone showed loss of osteocyte from the lacunae, peripheral resorption, and acute inflammatory infiltrate. Consists of mainly polymorph nuclear leukocytes. Treatment: bacterial sample for culture, heavy dose of antibiotic, give or prescribe analgesic for the patient to relieve the pain, drainage of abscess, debridement of the wound. Chronic osteomyelitis طبعا بصورة عامة الأعراض أقل and the pain is dull. And radiographic changes can be reported due to bone destruction and sequestrum formation. The presence of sequestrum is the main hallmark to differentiate between acute and chronic osteomyelitis. Suppurative chronic osteomyelitis. Non-suppurative chronic osteomyelitis عندنا 3 types: chronic diffuse sclerosing osteomyelitis, chronic focal sclerosing osteomyelitis, chronic proliferative sclerosing osteomyelitis or Gary's osteomyelitis. طبعا these type not caused by bacteria, unlike the suppurative osteomyelitis that caused by bacteria, whether acute or chronic. The real cause for non-suppurative chronic osteomyelitis unknown. وقسم يقولون لا relate to low grade infection and high immunity for the patient. طبعا the chronic osteomyelitis result from inadequate treatment of acute osteomyelitis. For example, infected fracture, pulpitis, periodontal disease, which lead to spread of infection to the medulla of the bone, and later on lead to formation of a granulation tissue. Clinical signs: swelling, pain, طبعا البين هنا dull, less in severity than acute. Sinus formation, purulent discharge, the formation of sequestrum. وهذه أهم نقطة to differentiate from the acute osteomyelitis. Tooth loss and pathological fracture. طبعا any spontaneous fracture not caused by trauma called pathological fracture. Radiograph, radiolucency will define margin similar to malignancy. And in advanced cases, sequestrum formed. Treatment for large lesion, surgical intervention, high dose of antibiotic given IV. For small lesion, curettage and removal of the necrotic bone. Non-suppurative osteomyelitis, قلنا this type not caused by bacteria. Focal bone necrosis, characterized by localized area of bone sclerosis, seen in young and children, associated with non-vital teeth. No expansion of the jaw, mild or no pain, because the tissue reacts to infection by proliferation and not destruction. The infection acts as a stimulus rather than irritant. Radiograph appear as a well circumscribed radiolucency around the apex of involved tooth. طبعا discovered by routine examination of X-ray لأن في أغلب الأحيان not associated with symptoms. In general, no clinical signs. Treatment either endo or exo. Diffuse sclerosis osteomyelitis يعتبر endosteal proliferative reaction due to low-grade infection. In contrast to focal sclerosis, osteomyelitis can affect any age, mostly affect body of the mandible and TM joint. Consider insidious in nature, no clinical signs. Radiograph diffuse or nodular sclerosis, cotton wool appearance. Clinical, mostly in adult, no genital predominance, no swelling, just vague pain. Histopatho, continuous resorption and repair. This will lead to what's called reversal lines. Neuro, morose, fibrosis with chronic inflammatory cells. Treatment, no treatment in general. The sclerotic area remain radiographically. فقط follow up for the case, متابعة الحالة. Proliferative periostitis اللي نسميها Gary's osteomyelitis. It is a rare disease. Consider periosteal proliferative reaction, mainly affect children and young adults, associated with low-grade infection. It is a type of non-suppurative chronic osteomyelitis characterized by focal growth thickening of mandible in lower border. Affect children and young, pain, tooth or bone, mostly seen in premolar and molar. Hard swelling on the outer surface of the mandible. Arise from dental infection or periodontal infection. Can affect the outer surface of the bone due to reaction of the periosteum. Histopatho, parallel rows of woven bone, trabeculae and perpendicular to cortex, fibrous connective tissue, and inflammatory cells can be seen. Treatment either endo extraction, no surgical intervention, need sometimes for biopsy to confirm the diagnosis, and remodeling of the bone for aesthetic reason in some cases. Now come to a dry socket اللي يعتبر infection and inflammatory process of jaw. إذن dry socket inflammation of alveolar bone appear 2 or 4 days after extraction, characterized by severe throbbing pain and bad breath. Causes for dry socket: partial or complete removal of blood clot. أحد أهم أسبابه هو إنه البيشنت rinse with hot water in the first day of tooth extraction. مضمضة أول يوم قلع السن. أحيانا due to blood clot not formed, or in case of a traumatic extraction, so the bone exposed. إذن dry socket الفكرة شلون تصير هاي الحالة. Normally after extraction of the tooth blood clot formed. Then after organization granulation tissue occurred. Gradual replacement by coarse fibrillar bone, and then the bone become mature. In alveolar osteitis or dry socket, there is destruction of blood clot. إذن الخطوة المهمة that initiate healing is the formation of a blood clot. When removed, prevent the healing process. This is occurred secondary to transformation of plasminogen to plasmin. تعرفون البلازمين cause lysis of fibrin. This is associated with the formation of kinin اللي يعتبر or responsible for severe pain encountered in patient with alveolar osteitis or dry socket. Factors stimulate fibrinolysis: local trauma, estrogen, or bacterial pyrogen. Then the main causes for dry socket: excessive trauma from extraction, the use of oral contraceptive tablet, pre-surgical infection, hypovascularized bone when the patient subject to radiation, for example, in case of a treatment of cancer in head and neck, or too much using of vasoconstrictor. Clinical signs: very severe pain, lasts 10 to 30 days, foul odor, exposed and sensitive bone. Treatment: irrigation with a warm saline, using of iodoform gauze with eugenol to reduce the pain. Should replace every 24 hours for the first 3 days, then every 3 days until granulation tissue formed on the exposed bone. Osteoradionuclosis. This is a serious complication of radiation of head and neck. Radiation causes obliterative endarteritis. This causes hypoxia, hypocellularity, hypovascularity, which lead to necrosis of the jaw. The severity affected by the dose of radiation, proximity of a tumor to bone, the presence of remaining dentition, and type of the treatment. Agent factor: old age, when the patient male, poor health and nutrition, smoking and alcohol drinking. Clinical signs: mostly in mandible, severe pain, perforation of cortex with fistula, ulceration of skin surface, and sometimes even pathological fracture. لذلك, all dental treatment should commence before radiation treatment. Pathological fracture may cause by a mild trauma. Then, prevention, treatment of all suspected teeth by extraction or endo prior to radiation, treatment of all focus of infection, in addition to keep good oral hygiene. Wait 3 weeks before initiation of radiation. Bisphosphonate, this drug mostly used for the treatment of osteoporosis. Bisphosphonates are a class of a drug that prevent the loss of bone mass. Mechanism of action: inhibit the action of osteoclast that is responsible for resorption of the bone. This is seen case of multiple myeloma, metastatic breast carcinoma, Behçet disease, osteoporosis after post-menopause. Thank you for listening.